Mm-hmm.
Okay, so once it's plugged in, this goes on the floor. I just set it there. Put that on the floor.
Oh.
You have a power button back here.
Oh,
You're gonna turn it on. Put that on the floor. And then there's a button back here. You push this, which turns it on, and you're gonna see the green light come on.
Do all this before the doctor comes?
Yep. All this, the only thing she's gonna do is when she sits down, this patient's gonna be completely numb, and you have to make sure they're numb. I'm talking, you gotta take the pointiest scaler, and you gotta poke until the gum bleeds a little bit. Because if they don't feel that, they're numb. If she comes over and she sits down and they're not numb.
Okay.
So what I do is I see the patient, and the first thing I do is I'm gonna numb them. So you're gonna use this and Q-tip, and then what I do is I take some of this out and I put it on the gauze. Before you numb them up, you want to take a gauze and you want to dry the gum tissue off really good. And then you're going to, so say if we were doing the cuspid, you're going to put it facial. I put it a little bit where the incisal would be, and a little bit on the lingual. It just ensures that they're nice and numb. Once you get that on there and you rub it on there, take a piece of gauze, fold it up, put it over the area, and have them bite. That way they can't touch it with their tongue, and their tongue doesn't get numb. I like to let them sit there for...
Well, I have, but no.
I do 5 minutes, and then after 5 minutes, I do the poke test. If they're not feeling anything, that's awesome. If they are feeling something, you want to put a little bit more, cover it, do another 3 minutes. Now, you always want to ask the patient, do you feel it starting to tingle? Because they're going to feel it.
I thought you rinsed that.
I wipe it off. You wipe it off with the gauze. So after, because it kind of absorbs into the gum tissue anyways.
Okay.
If they're not numb, put a little bit more on, cover it for another 3 minutes. And then you want to keep asking them, is it getting numb? Is it getting numb? Is it getting numb? After that, again, you want to give a nice poke test, make sure they're not feeling anything. And then in the meantime, when they're numbing, you're going to turn this on. It's going to ask you for a code. The code is right here. So you're going to hit 2974. And then the screen's going to pop up. You always want to hit gingivectomy. And you always want it to be on 4.0. Now, sometimes she can ask you to change it. If you need to change it, you're going to hit the power.
Is it just the strength of the laser?
Mm-hmm.
Okay.
So she usually always does a 4.0. If she wants to change it, you'll hit power, and then with these buttons right here, you can increase or you can decrease. It all depends on how thick the gum tissue is. So go back there. Now, the next thing you're going to do is you're going to take this and you're going to open it. Try not to touch it with your hands. You're going to take this and you're going to put it on.
It just snaps right in?
It just snaps right on. Then you're going to take this off. And then I use, Ellie, can you grab me that cutter? You use a cutter and you want to cut it down. I go like maybe halfway because you don't need all of it. You're going to cut it. That's all you need. Then you're going to take your hand and you want to round it. We used to have a little thing that rounded it for you, but if you just use your finger, this is how you want it to look. Okay? Now you always want to make sure that it's primed and ready before she comes over. This is where your articulating paper comes in. You're going to take your articulating paper, you're going to take this and you're going to scrape it like that.
What does that do?
It initiates it. And then you're going to hit this. Nobody look at it. You're going to hit OK. It's going to tell you laser is ready. Now you see how the tip, you can look at that. See how that?
Thanks.
Then what you're going to do is you're going to hit this, you're going to hit this yellow button and you just see it's going to spark. As long as it sparks, it's ready to go.
Well, I don't know if it was ready because I was
Yeah, my eyes are closed.
You can look at it for a second. Ready?
Okay.
Oh.
Okay, it's going to spark. You're going to see some smoke come out of it. Okay? It's initiated, it's ready. And you're just going to put this back up here. You can actually hit back up a little bit because you don't need it to sit there and wait. Right, as long as it's initiated, it's good. When she comes over, make sure that the patient already has theirs on. This is the patient. This is doctor.
Doctor has the red stripe.
Yep, and this is assistant. So you want to make sure the patient has theirs on. You're going to give these to doctor. You're going to put yours on. you're gonna hand her this, and then she controls everything with this button here. And then when she's doing it, you always want to make sure that you're doing this. Otherwise, they're gonna see the smoke and they're gonna smell it. It freaks them out. So make sure you're using this right here. She will keep going. Once she gets down to the tooth, she'll usually grab a scaler, which this is already going to be open because it's going to be just like you're working. She'll grab a scaler and she'll kind of scrape, which takes off the excess gum. And then she's also going to probably ask for a gauze too to get the extra stuff off of the tip here and to get it off the tooth.
So it's cauterizing it while it's...
It is.
Okay.
Yeah, it doesn't bleed. If we get enough uncover of the tooth, then when she's done, she's going to walk away. You're going to do your thing with placing a button or an eyelet. You will bond it, put the wire either through the eyelet, or if you're putting a button, you'll put the wire over the button, and then you got to put trans bond over it.
Okay.
So it coats it so it doesn't come off and it's smooth to their lip.